Afternoon, doctor. Is it good seeing me again?
What can I do? Do you have it?
Why you need to call me to me now?
Yeah. Tell me what's up. What can I do for you?
Alright, so I'm here to do, we have to review the form, because I'm not really here by myself. I'm here because I need to complete a supplement blood pressure test along with, sorry, I'm just looking back what he said I should do. Alright, so it's a supplementary blood pressure test and the psychological questionnaire form. You're seeing that? Alright, good.
Okay. So the blood pressure check. We'll do this first. So the first part to be completed by the applicant. Have you ever been told that you have high blood pressure?
No.
No. Have you ever received treatment for high blood pressure?
No.
Are you currently taking medication
No.
for high blood pressure? Name of medication used and date? You never use no medication?
Not applicable.
Okay. Name and address of doctor consulted?
Not applicable.
So your signature, witness, I could witness it for you. I could let the nurse witness that, yes. I'm gonna sign here. March the 24th, to the 24th.
Yeah, I should think so.
Alright, so first blood pressure reading was 122. On 2278. Next one was done at 4.
Like this. Yes.
Alright, here we go. This is the first one.
That's what, my record?
Yeah?
That's my record? Okay.
So why do you need a psychological evaluation? Why do you need a psychological disorder questionnaire?
I don't know. I guess I don't know.
Okay, so here's what they asked. Alright. So type of disorder.
What disorder there is?
That's why I'm asking why they give you this if there's no
I
disorder.
don't have any disorder. I don't know.
Then the next question is date of first attack, date of subsequent attack, if any, cause, treatment given, result. If treatment continuing, what was the period hospitalization? So
Does let me ask you this. if you had depression in past time, that would need for me to complete that?
Mm-hmm.
Okay.
So you want treatment?
No, never have been.
Did you tell them you had depression? Because if you have to understand, if you tell them that, they're going to ask you to do that.
Come on, I've never really.
Let me look at your
I'm
digestive.
try.
You did a digestive disorder for years with symptoms first experience. They didn't put disorder diagnosed in the past. Digestive disorder, who filled this one?
I mean, I have no. I had 20 back in 2020.
You were admitted
Who?
at the hospital?
No,
You went to a doctor?
I came here and I saw a doctor who wasn't friendly or nice. It was a horrible experience though. But I was like sick for almost a month and I received healing for about it and God helped me. I didn't have to see a psychologist. That's what it's called? Or I didn't have to take any form of medication or anything like that. So I don't know, doctor. I don't have any yeah. Whatever it was, God helped me through it and I am good.
I see here during the filling of this form here, this is why it's stated here on question 10: epilepsy, seizure, convulsion, headache, frequent giddy or fainting spell, loss of consciousness, loss of use of limb, muscle weakness, disturbance of speech, stroke, TIA, multiple sclerosis, motor neuron disease, Parkinson's disease, tremor, tropical spastic paralysis, or any nervous or mental illness such as depression with suicidal thoughts. And it was tick, yes.
For depression.
Hold on. Clients has not been depressed, has not been, what is that? I think that something with depression and has episode of let's look at depression. Then the other question you answer yes to also. Sickle cell, you have sickle cell trait.
Yes.
There's the next one stated there. 3 years ago on it also stated, have you ever vomited blood or so? Yes.
Ah, no? I've never vomit blood. Maybe that was a mistake. Never vomit blood yet.
Stated 3 years ago.
3 years.
Patient had bright red blood in stool.
In stool? That is over like 10 years ago.
Alright, so for the depression, let's just fill this off quickly. Alright, so tell me whatever you know. So type of disorder, we put depression here.
Alright, but there and then I couldn't sleep. What you call that? Having issues sleeping.
It's not nothing to do with that. It's what was diagnosed then. So
I didn't get any diagnosis. I didn't. Here, I think back in 2022. When it happened, I wasn't really given any diagnosis. You're not seeing anything for 2022. I don't have any date on it, but back in 2022, here.
I don't see anything. Oh. So here they send you to see the therapist. On March 2022, Medical for school, chief complaint palpitation, history of anxiety and depression, examination unremarkable. Assessment was physical fit, anxiety and depression disorder. So we're gonna put that there. So anxiety,
Which I no longer have. So
I'm gonna make sure I put that.
which I no longer have.
Date of force attack is March the 22nd, 2022. Non more attack, right?
As of April 2022.
Okay.
Yeah, ending at April.
Cause, what was the cause then? Anything?
When you think about something over and over and over and over, what's that called?
Overthinking?
Well, yeah, and it may sound weird. Oh yeah, overthinking.
I put cause unknown. Cause overthinking is not cause. Treatment given, sick leave. Sick leave plus worse. Alright?
Prayer.
Result, good. Is treatment continuing?
No.
What was the period of hospitalization? Not applicable. What is the period of absence from work? Was 3 days, right?
No, 3 weeks.
3 weeks? But they give you 3 days sick leave. So let me just go with
Yeah,
it.
but I was out more than that.
You want me to put 3 weeks there?
Well,
I think you should put 3 days instead.
no, but that's a lie. It was
Okay, I'll put
way
it 3
more.
3 weeks. Okay.
Maybe 6 weeks.
Has this or previous episode, if any, needed treatment by a psychiatrist? You went to
No.
this? No. If yes, no. Any suicidal attempt?
No.
Any problems with alcohol or drug related? Okay. Has there any reasonable adaptation environment? Reasonable adaptation to the environment, and is the occupation stable?
Yes.
Assessment of response to therapy, good. Is patient completely cure or will absolutely completely cure, right?
Yes. By God's grace.
Is there any family history of mental illness?
No.
None. Name of medical attendant, Dr. D. Samir. Address.
You can put 6 weeks for the time that I was out. Yeah, thanks.
After 6 weeks, consign it. Okay?
Yes.
March 24th, 2025. Alright, that's it.
Alright.
So we'll find anything at the back, you know? Anything I gotta fill here too?
I don't know. What does it look like?
Dear doctor, we currently considered applicant for insurance of. I only see you once. I don't see you.
Yes, this is the second time you're seeing me.
I'm not sure if you want me to write all of these here. Dr. Lisa Harlock, who's that? Dear doctor, on the life of the above may we include applicant authorization for us to obtain such medical information as required. We ask that you complete this form giving information and medical history from consultation with the applicants with particular reference to medical history consultation result of any test, and kindly include history of depression. Kindly complete the form and question. Okay, I'll fill this out, I guess. Alright, so let's see all the days that you come. So the first date here, date of attended, date 02/02/2018. Reason for consultation: mild weakness, nasal congestion, hoarseness. Assessment was respiratory tract infection. So
What was it?
infection in the upper respiratory tract.
Oh,
Here, mild weakness, nasal congestion. Diagnosis: duration of illness was 3 days, considered for 3 days sick leave. And diagnosis was upper respiratory tract infection. Described treatment given then was acyclovir cream, and 3/7/2018 you came for.
can I make a call?
Sure. This is second insurance taking.
Hmm?
This is the second insurance.
Yes. Then, even, you can call Patrick and tell him send me soon come, please. Yeah, he can. See.
They didn't do the blood test, no?
Forward.
I did the last time when it came in 2022.
2020?
2022 for the depression here, the doctor had written for you to do some blood tests.
No.
That's it.
That's it.
Mm-hmm.
I guess they're gonna come and pick it up,
But you have
right?
to sign anyway. Make sure you don't have to sign. I think you have to sign there. No witness signature of applicant. I already know I've signed this one.
So based on my overall test, does it mean that my health is in good standing? Mm-hmm. You know, give me that reassurance.
Okay, how old are you? How old are you?
Oh, how old am I? I am 36. 37 in a few. Lies in. Sign here. Signature.
And I didn't must know sign that to be.
You want me somebody sign that?
Yeah, give them at the front so they sign.
Give them at the front, tell them to sign. Alright, that's all. Have a blessed afternoon.
Give me that other docket there.
Which, oh, this one?
Yeah.
Alright, here you go.
Leave it up.
Leave it open, I'm sure.
Gray? Come. How are you doing?
Come on.
What are you doing? What can I do? Driver's license?
Yes.
This was for university. University of Technology.
Yes.
Everything went okay with that?
Yes. I had to do back over the report though.
Why?
She said the results were.
The blood test. So you have to do back all of this?
No, not that. She said I should just go to the American one. She said.
First name?
Tamice.
Spell?
Tamice.
Tami.
CE. GRA.
Address?
Toa District.
Spell?
TOWER HILLDRICT. Toa Hill.
Tower Hill District, Tower Hill, PA?
Yes.
PA?
Yes, PA.
You sure there's not any?
No, it's PA because it's the single.
P dot A?
Yes.
You sure not P O P?
No, because it's only alone go to them. Post
Okay.
office.
Date of birth?
March 7, 2007.
March.
Yes.
How old are you now?
18.
Height?
I don't know.
162 centimeter. Weight? 67.7 kg. Eye? 2015. With glasses, without glasses?
No.
How long you be on this clinic for? 1 year now? Couple months? 6 months. Maybe 6 months. What is 6 months?
Okay.
Come start here. You work?
No.
You don't work? So you do it. You go to school, college, or what you go to college? What you do here?
Business admin.
Alright, so diagnosis, table, plan, driver's license, medical, giving. Alright, I've seen and examined you already, so I don't see you have any problem for not driving a motor vehicle, okay?
Okay.
You're welcome there.
I must take this.
To the front desk, you need to stamp it.
Oh, okay.
Open the door there back for me. Davis, Joshua Davis.
Here.
Bro, this place
Okay.
is too cold.
So
That's
should
why
we sit in or wait? Okay.
oh my god. Why are these seats so cold?
It's plastic. Oh yeah, that's how it goes. Shitty.
13.
Open.
It's here.
You
Yes. Why do I feel so stretchy? Mommy, that's. It says. We think it's sugary drink. Doesn't even have water in it.
Yeah, but then the same thing drink where you drink where you think you have the water in there. Pure sugar and coloring. By the time you done the water or the night so like a bit drinking too much sweet juice.
I'm wearing a sleeve over the jacket.
Okay.
$3.28. 328. $3.36.
I'm gonna make my phone. You're not doing that with my phone. I said you're gonna make my phone drop. You can't
Good
do that.
afternoon. Again, how are you doing? What can I do for you today?
Well, I should have come here from maybe 2 weeks ago. Because he had hand and mouth disease and his skin still recovering, whatever it is, and his mouth still hurting him from time to time. But what is predominantly at him for the longest while is his body is just hurting in general. Sometimes he cry, sometimes him just
Like where? In the knees and so?
ask him.
Everywhere.
For how long now?
From him
Do
born
you have
till
sickle
now.
cell?
No, I don't have sickle cell. I'm sure we did the sickle cell test when he born.
Do you have the result?
I'd have to check it out. But I'm sure he doesn't have sickle cell. I remember that. He was born in America and him run all of them tests there originally. I remember
It's
all of
okay,
that.
but do you have the result to show?
No,
that?
I
If
didn't.
not, I will have to send you to do it back, you know.
Sure, not a problem.
Because the most common causes of generalized pain is sickle cell, and then have other things like autoimmune disease and so on.
There's something autoimmune going on in the system. I don't know what it is. Can you catch something autoimmune, or is it something that can a bacteria or virus cause autoimmunity?
Yes,
Okay.
you can. Study have shown that most autoimmune disease actually come from a viral illness. So I could screen him for autoimmune disease as well.
Yes.
Alright, so the chief complaint today you said is generalized pain.
Yes, which is which you cry almost every. Listen to me. That's going on for years, you know. Where I'm pretty much at the point where I can't do
So
anything.
do the sickle cell test and the autoimmune
I'm
disease.
sure it's not the sickle cell, but the autoimmune disease.
Let's do it and
That's a
see.
possibility.
You have juvenile rheumatoid arthritis and so on. So let's do the test and see. So right now you're having pain? So you give him
Every
anything
day.
for the pain?
Every day I'm
Every
testing.
day and at
Every
school.
single.
You give him something for the pain?
No.
So why don't you try something?
Only time I give him something for pain is when him cry. Sometimes him can
What
manage
you
it,
give it?
and when him cry, I
What
give
you
him
Ibuprofen.
like the liquid Panadol or the liquid whatever it is or whatever.
Or
Yeah,
ibuprofen.
like Panadol.
I'm gonna give him some ibuprofen or cataphan. I'll take 25 milligram cataphan.
So I have a theory to give you, but I can't give you in front of him. I'd like you to sit down outside and I'll tell you that theory.
Okay. Any cough or cold?
Yeah,
Yes.
he has a cough for the past 2 weeks or even more now. Lingering. Yeah, I say I should have come with him a long time because a student bit him a wicked bite, you know. And I know usually they get tetanus shots or whatever.
Any fever?
When after the bite,
Any shortness of breath or so?
I don't know, Joshua have any shortness of breath?
I would ask you also, you can check with a pediatrician. You know a pediatrician?
What does that mean?
No, maybe you need to give me a pediatrician number.
I have Dr. You know Dr. Dunn?
What does that mean?
Relax, Joshua.
She's at Skillet next to Boog there.
Shekamet or something?
Yeah, something like that. skillet, you know, skillet.
Skillet or
I'm
Shekemet?
whatever it is, I'm not sure how they come up with that name.
Yeah, right. I
But
think it's a Egyptian name based upon the sign that they have beside
so
it.
who put it in
Yeah,
Egyptian?
Shekemet. It seems like a Egyptian.
Shekemet.
Sekh something like MET, something funny name
So
like that.
Dr. Dunn was there, so you can go and check in there.
I've been there before.
So Dr. Dunn's a pediatrician. So I could write up for them tests and I could give her a report and you can check it out. She would know more because she's a pediatrician. I could do the basic tests and so on. I check him now. Mm. It seems like he have an infection there too. I'm giving some antibiotics as well.
Stop that pulling that cold. Go on up, babe.
Sit on the bed.
I know, stop close that cold, man. Go on up on the bed. Yeah, he's been going on with that cold for a little while. His skin's breaking out and sometimes it just break out in all kind of bumps and it's tormented over it too as well. Do you feel it on
Ask him if you still want to register first. Good. So, he is claiming that the son have something that is passed on from the father to the child during sex. So, do some tests, but the mommy called the father for me to ask him some questions to see if I could figure out what is happening. So I tell the father to register so I could see him, but he said that let the son do the testing first. So there is where we are.
Oh, okay.
So find out what they're gonna do. Come, you gone? I tell him that he registered. He said he want his son to do the testing first. Y'all married? Y'all married?
Mm-hmm.
Okay. Y'all live together?
Well, right now in two separate rooms, so
I don't think he will like that there, but I see him. I would have loved to him for register. Let me ask him some question, but he doesn't want that.
you register the process, but you never do the test. Don't even want to
You
do
see,
the
register
at
already?
the front.
You get a docket?
Yeah, they have him docket around there. They wanted
So why
to.
you left for then?
They wanted to do now with high blood pressure and
So
whatever.
where
And
is he now? He gone?
him inside there.
So let him register. Let me ask him some question now.
And you never know that he was registered already.
Let's find out what's happening.